What's up, everybody? It's Sean again, coming back at you again from Media Windog Watchapeg and also from Winnipeg Alternative Media. I'm here to make another video. The topic for today's video, once again, is going to be masks and whether or not they work and what the science says about them. Just quick breakdown of what we're going to cover in this video. I'm going to try to keep it as short as possible. Quick, first thing we're going to look at CDC and the WHO and the statements that they have on their websites over whether or not masks are effective at preventing or slowing the spread of COVID-19. And then we're going to look at a couple pieces of fairly high quality, one piece of like absolute top level gold standard science on whether or not masks are effective, one piece of kind of somewhat quality piece of science on whether masks are effective. And then I'm going to talk very briefly about certain health experts and their flip-flopped stances and flip-flopping stances on masks and whether or not the public should be wearing them. And then we're going to look at a couple of pretty trashy pieces of science that those health experts used to support their flip-flops. So let's jump into it, shall we? Like I said, first thing we're going to look at here is some statements from both the CDC and the WHO on what their findings are on whether or not masks are effective at slowing the spread of COVID-19. This is from the CDC's Public Health Guidance for Community-Related Exposure page. So, public health guidance. So, community, public health. What do they say? Scroll down. This table here that they have, real quick, is the list of the groups of people that they recommend get tested for COVID-19. The first group or person on the list is an individual who has had close contact for 15 minutes or more, close contact being 6 feet or less. And if you are this person who has had close contact for 15 minutes or more to or with a person with COVID-19 symptoms or a person who has tested positive for COVID-19, they want you to go and get a test. That makes sense. However, they add this little tidbit at the bottom that says this is irrespective of whether the person with COVID-19, this group or this person here, or the contact, this person here, was wearing respiratory PPE. So it doesn't matter whether either you or you were wearing a mask, they still want you to go get a test if you're within close contact for more than 15 minutes. Not really, that to me doesn't say they have an overabundance of faith and confidence in the mask's ability to prevent the spread. But then if we scroll even just a little further down this page, we are going to highlight this little section here. And we are going to read because they kind of do an even more detailed breakdown of that little note from above. It says, while research indicates masks may help those who are infected from spreading the infection, there is less information regarding whether masks offer any protection for a contact exposed to a symptomatic or asymptomatic patient. Therefore, the determination of close contact should be made irrespective of whether the person with COVID-19 or the contact was wearing a mask. So again, doesn't matter whether you, the contact, or the person who was potentially infected or confirmed to be infected, the patient, was wearing a mask. So again, not really showing a lot of faith and confidence in the masks. And then they follow that up by saying, because the general public has not received training on proper selection and use of respiratory PPE, it cannot be certain whether respiratory PPE worn during contact with an individual with COVID-19 infection protected them from exposure. And this bit about the general public not receiving proper training and selection on use of respiratory PPE is going to be important in just a bit. But for now, we're just going to pop over to the WHO's website. This is the Q&A on masks and COVID-19. Oh, real quick, this page was last updated on the CDC here July 31st, 2020. So they've had ample time to change this and update the science if they had any science to update it with. And this Q&A page from the WHO is from June 7th. So they've had almost two whole months more to update their statements and their stances. But we are just going to read this whole section here. What is WHO's view on masks? Masks should be used as part of a comprehensive strategy for measures to suppress transmission and save lives. The use of a mask alone is not sufficient to provide an adequate level of protection against COVID-19. You should also maintain a minimum physical distance of at least 1 meter from others, frequently clean your hands, and avoid touching your face and mask. Medical masks can protect people from wearing the mask. Medical masks can protect people wearing the mask from getting infected, as well as can prevent those who have symptoms from spreading them. WHO recommends the following groups use medical masks: healthcare workers, anyone with symptoms of COVID-19, people caring for suspected or confirmed cases of COVID-19. Medical masks are also recommended for these at-risk people when they are in areas of widespread transmission and cannot guarantee a distance of at least 1 meter. People aged 60 or over. People of any age with underlying health conditions. So you'll notice, though, in this whole section on who they recommend should wear masks in public, they don't say that the whole public, the entire population, should wear the masks. It is only these at-risk groups here, right? And then these at-risk groups here. Those are the only people they recommend wear the masks. And then they really drive the point home with this whole paragraph here, where they then almost immediately contradict themselves / pass the buck of responsibility onto someone else. But we're going to read real quick. Non-medical fabric masks are being used by many people in public areas, but there has been limited evidence on their effectiveness, and WHO does not recommend their widespread use among the public for control of COVID-19. However, for areas, and this is where they start to contradict themselves and pass the buck of responsibility onto someone else. However, for areas of widespread transmission, with limited capacity for implementing control measures, and especially in settings where physical distancing of at least 1 meter is not possible, such as public transport, shops, or other confined or crowded environments, WHO advises governments to encourage the general public to use non-medical fabric masks. So the WHO themselves do not recommend their widespread use among the public for control of COVID-19. However, they do advise governments to encourage the general public to use non-medical fabric masks. So they just don't want to be the people that are like, yeah, we were the ones that told you or recommended that you wear the masks. We want the government to be the one that recommended you to wear the masks. Just in case this whole thing if it's gonna blow up in someone's face, it's gonna blow up in someone else's face. It's not gonna blow up in the WHO's face, because they said right here, WHO does not recommend their widespread use among the public. They just advise the government to. So these are the statements from the most recent statements I could find from the CDC and the WHO on what their findings are on the efficacy of masks. But now, like I said, I've got a couple new pieces of science and scientific literature that we can look at that kind of back up these statements, and one of which is a very top-level, gold standard piece of scientific literature. This right here is the Heirarchy of Scientific Evidence in ascending order of strength of evidence. You'll notice right at the top is meta-analyses / systematic reviews, and then right below that is randomized control trials. And then everything in this section down here is observational research, which can't prove causation, which means that it doesn't prove shit, essentially. And then the very bottom level is case studies and reports. This is essentially anecdotal evidence, I believe. I'm not 100% certain on that, though, so don't quote me. But it doesn't matter, because we're going to be focusing on these two sections here, or these three sections here, almost exclusively. So this is our Heirarchy of Scientific Evidence, meta-analyses and systematic reviews right at the top, and then randomized control trials right below that. Now we're going to pop over to this piece from the International Journal of Nursing Studies from August 2020, that is this year. This is a rapid systematic review, again, systematic review, top level. Rapid systematic review of the efficacy of face masks and respirators against coronaviruses and other respiratory transmissible viruses for the community, healthcare workers, and sick patients. Methods. A systematic review of randomized controlled clinical trials. So again, systematic review, randomized controlled trials, top level science. Now let's skip to the results. And the conclusion. Too far. Results and conclusion. A total of 19 randomized controlled trials were included in this study. 8 in community settings, 6 in healthcare settings, and 5 as source control. Blah, blah, blah. In the community, masks appeared to be effective with and without hand hygiene, and both together are more protective. Randomized controlled trials in healthcare workers showed that respirators, if worn continually during a shift, were effective, but not if worn intermittently. Medical masks were not effective, and cloth masks were even less effective. That's in the healthcare settings. That's in like hospitals and shit like that. When used by sick patients, randomized controlled trials suggested protection of well contacts. That at least makes a little bit of sense to me. If you are the sick person and you're like coughing and sneezing and all that shit, wearing a mask will at least prevent like your spit and your phlegm and your snot and all that shit from flying all over the place. Whether or not it does anything about the vapor droplets or the aerosol droplets or whatever the fuck they're supposed to be called, that's kind of what is still up for debate here. That's kind of the whole point of this video, but this part at least to me makes sense. If you're the sick person and you're coughing and sneezing and all that shit, it will help keep some of it in. Wearing a mask will help keep some of it in and keep prevent some of it from spreading around at least. But again, like it says, in a healthcare setting, medical masks were not effective and cloth masks were even less effective. It says that in a community setting, masks appeared to be effective, both with and without hand hygiene. But now I'm going to, so the conclusion real quick says this study suggests that community mask use by well people could be beneficial, particularly for COVID-19. Yeah, so now we're going to pop from this top level, again, piece of gold standard science, over to this article from the New England Journal of Medicine. Excuse me. This is from May 21st, or last updated May 21st. I believe it was originally published April 1st. And this is just an article, so it's pretty low on the pyramid of, or hierarchy of scientific evidence. I'm not sure exactly where it falls because I'm not sure exactly where in this area the article would fall, but it is not a randomized control trial or a meta-analysis, so it falls either under observational research or case studies and reports, and I believe it would be the bottom level. So this is not very high-level science, but it does say pretty definitively, we know that wearing a mask outside of healthcare facilities offers little, if any, protection from infection. So wearing a mask outside healthcare facilities offers little, if any, protection, according to this article from the New England Journal of Medicine. But according to this article or this study review from the International Journal of Nursing Studies, medical masks in a healthcare setting were not effective and cloth masks were even less effective. So if they're not effective in healthcare settings and they're not effective in community settings, where are they effective? And so I think the important part of this article is this last sentence of this paragraph here, which states, again, very clearly, in many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic. CDC, WHO, we have little to no evidence to support masks being effective. Systematic review of 19 RCTs. Medical masks not effective in healthcare settings, only appear to be effective in community settings. This article from the New England Journal of Medicine. Wearing a mask outside healthcare facilities offers little, if any, protection. And again, in many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic. So this all really makes it seem like the masks and the mask mandates are meant to make us feel better, but aren't actually doing much, if anything, to actually make us actually be better or be any safer. Now from here, I want to quickly, very briefly talk about, like I said, a couple of health experts who have flip-flopped on the mask topic, specifically Dr. Theresa Tam and Dr. Anthony Fauci, who are Canada's and the United States' top COVID-19 health experts, respectively. In the early going of the coronavirus pandemic, both Dr. Tam and Dr. Fauci they explicitly said, we do not recommend general public mask use because there's little to no scientific evidence to back it up. Those were pretty much almost their exact words. They both said, we don't recommend masks in the general public because there's not really a lot of evidence to back it up. And then later, they flip-flopped on that and said, now we do recommend the public wear masks. And when they were pressed on why they had the sudden change of heart, one of the reasons that they gave was that they wanted to make sure in the beginning that there was adequate supply of PPE for healthcare workers, which is fine, I'd respect that, but at least fucking tell us that up front. But then the other reason that they gave for the flip-flop and the change of heart on whether or not they recommend masks was that they said there has been new evidence and new science to promote or to suggest that masks are effective at helping to prevent the spread. So I went and I looked at what these pieces of science were, and we are now going to use our friend, the Heirarchy of Scientific Evidence, to tear this science apart and show you that it is not worth the paper that it is written on. So this is from Oxford Academic, the Clinical Infectious Diseases page. This is a paper, I don't know what you call this, a study titled Surgical Mask Partition Reduces the Risk of Non-Contact Transmission in Golden Syrian Hamster Model. So it's a model. It's not a study of anything. It's a model that they made. So who knows? But let's look at the results. Actually, you know what? I'm just going to gloss over this real quick. I'm going to show you a picture of what the setup was. This is the gentleman, one of the gentlemen behind the experiment, showing the setup for the experiment. And so essentially, I'll give you a quick rundown of what the experiment was. You can see here they've got these cages stacked one on top of the other, and then 2 columns divided by a partition in the middle here. You can see right here, there's kind of like a divider or a partition between the 2 stacks of cages. And then there's holes. You can see by this zoomed in, blowed up picture over on the side here that there are holes cut into this partition to allow air to transfer through, basically. And so essentially what they did was they put one group of these hamsters in these cages that was infected with the influenza virus, I believe, if I remember correctly, or maybe even the COVID-19, I believe it was specifically the COVID-19 virus. And then they had an uninfected group of hamsters in this cage, and then they just measured the rate of transmission and the rate of infection in the uninfected hamsters when the holes were completely unobstructed. And then they reset and redid the experiment. And the way that they redid the experiment to test the masks was essentially, and you can see it in the blown up picture on the side here, they just put a mask over the hole, basically. And then reran the experiment and said, oh, well, a lot less of the hamsters on this side got infected, so clearly the masks are effective at spreading the virus, the SARS-CoV-2, the COVID-19 virus. Here's the problem with this, though. This is, as I said, pretty garbage science, pretty low-level science. This is, at best, going to be in the observational research category, but I'm pretty sure, if I'm not mistaken, this falls under the case studies and reports research, because as far as I'm aware, this hamster study has not been replicated or reproduced even once, at least not by anybody other than the guys who originally did it, or the folks who originally did it. It is not peer-reviewed as far as I'm aware. It has not been analyzed by anyone other than the people who did the study. So as far as I'm aware, this is a case study that is non-peer-reviewed, has not been replicated or reproduced in any way by anyone other than the people who originally conducted the study. So not very good science. The other piece of literature that was pointed to suggest masks are effective was this piece from The Lancet entitled Physical Distancing, Face Masks, and Eye Protection to Prevent Person-to-Person Transmission of SARS-CoV-2 and COVID-19. A systematic review and meta-analysis. So I go, oh, okay, this seems promising. It's a systematic review and meta-analysis, which again is very high-level science. It's the top level, in fact. But then if you scroll down and read the methods, or is it the findings? Yes, the findings. Our search identified 172 observational studies, i.e. observational research, which again can't prove causation, across 16 countries and 6 continents, with no randomized controlled trials and 44 comparative studies. Comparative studies are, again, like it's just comparing one thing to another. They took COVID-19 and specifically compared it to something else specific and determined whether or not they were similar. Pretty crappy science. It's super vague and it can be manipulated in all kinds of ways, but I wanted to focus in on this bit, these 2 bits specifically here. The quote-unquote systematic review and meta-analysis was done on 172 observational studies, and they admit right here that no randomized controlled trials were found to fit their parameters. So if we pop back over to our friend, the Heirarchy of Scientific Evidence, yes, it is a systematic review, but it is a systematic review of observational research, which can't prove causation. So doesn't prove anything, even though it is a systematic review. It's a systematic review of garbage, non-causation proving science. Whereas this piece that I've been using to back up my stances and to kind of poke holes in the narrative is a systematic review of 19 randomized controlled trials. So it is a systematic review of randomized controlled trials. So it is a gold level standard piece of science doing a review of 19 other gold level standard pieces of science. Way better than either this stupid bullshit hamster project or this stupid bullshit systematic review they did of these observational studies. So I'm just going to close those now and get them out of here. So that's basically all I wanted to talk about. Quick recap of everything we covered. We looked at the stances and statements from both the CDC and the WHO and what they have found on masks. They both agree there's little to no evidence to back up masks being effective in a community setting. We looked at the systematic review of the 19 RCTs, basically saying that masks appear to be effective in a community setting, which is the exact opposite of what this article from the New England Journal of Medicine says, which is that we know wearing a mask outside of healthcare facilities offers little, if any, protection from infection. So in the community setting, it says here that it offers little, if any, protection. And in here, it says it only appears to be effective in the community setting. And in the healthcare setting, medical masks were not effective. So these two articles both saying not effective in a healthcare setting, not effective in a community setting. So where are they effective? WHO, CDC, both saying they don't have any evidence. These two pieces of, this piece of really solid science saying there's little to no evidence, this piece of pretty crappy science still saying there's little to no evidence, and then we covered those other two trash pieces of science saying that there was some evidence, but we said, I covered again why they weren't worth the paper they were written on. So that's the end of this video. I tried to keep it short, but I rambled and raved a bit longer than I could. But this is kind of a big topic, and it's hard to condense this down into like a 5 to 10 minute video. So if you've stuck with me till the end, thank you very much. I appreciate it. If you enjoyed this, please leave a like on my video, subscribe to my channel, go over to my Facebook page and leave a like there, Media Windog Watchapeg. Make sure you follow Winnipeg Alternative Media everywhere you can. They're on pretty much every social media platform you can think of. And that's about it. I will see you guys very soon for another video. Ciao, ciao.